the recording of my long trip, from the north of Vietnam to the south of Vietnam, and the last week I spent on Phu Quoc Island, before I returned to Norway. To consider the life stages of each patient while following chronic disease. Points of concern in clinical practice naturally vary among female patients depending on which stages they are in, i.e., in puberty, at reproductive age and wishing to have a child, or the elderly. General establishment of the term gender differences in medicine is facilitating the research in female subjects, including the accumulation of clinical findings, development of relevant guidelines, and drug treatments based on gender differences. On the other hand, to consider women's health issues from a wide point of view beyond biomedical problems and psychosocial and social aspects, it is necessary to obtain insight into the physical characteristics of women in each life stage and their roles in the socio-cultural context in order to understand their mental and social background. Different health issues may arise from the livelihood of each stage, some manifest as physical symptoms. Because health status in one stage influences the next stage, having knowledge of the framework of life stages can bring deeper empathic understanding in a clinician and lead to the discovery of potential problems and/or solutions. For a physician who wishes to take care of female patients in accordance with their needs, an understanding of the position and role of women at each life stage would be helpful in daily practice and in providing support to patients. Changes in the life stages of women in Japanese society. Major changes have occurred in society during the past half-century, and women's lives have changed greatly compared to the previous generation. Longevity has increased in both males and females. The popularity of higher education and changes in the concepts of marriage have given rise to increasing numbers of people not marrying or marrying later in life, often causing delays in events in life stages. On the other hand, the onset of puberty and the timing of first sexual intercourse are occurring at increasingly lower ages. Along with the declining birth rate, the trend away from multi-generational household has caused changes in the role of family. The divorce rate is on the rise, but it is still difficult for women who have been full-time housewives to find jobs with good employment conditions. Consequently, many households with single female parents often suffer from poor economic status. The recent socioeconomic situation, which has been characterized by stagnant wage growth, corporate downsizing, and increasing numbers of temporary or part-time workers, has fostered positive views towards employing women. However, the number of women with temporary jobs has increased rapidly, and there remains a large gap in earned income between male and female employees. The idea of fixed gender roles remains tenaciously in Japan, placing the burden of household duties and child-rearing tasks more heavily on women. In the area of in-home caregiving for elderly parents, 80% of the cases are reported to be done by females. In general, women spend large portions of their lives caring for others, first aging parents and subsequently spouses. In Japan, the Equal Employment Opportunity Act was enacted in 1985 and amended in 1997, and along with the Basic Law for a Gender-Equal Society that was enacted in 1999. A basic framework for gender equality was prepared in Japanese society. Generally, women now have more options in the way of living compared to the past. However, gender equality has not been fully established in the fields of politics and public administration, work environment, and in households. Rather, considering the current society that allows females to have higher education more easily and a greater variety of choices than before, some women tend to feel it is their fault if they are unsatisfied. It has been pointed out that, at each life stage throughout their lives, a woman is expected to have certain socio-cultural qualities such as interest in others, attentiveness, cooperative and nonviolent attitudes, gentleness, and kindness. Such gender issues related to multiple roles affect the degree of satisfaction and freedom to make major life choices in a woman's life when making decisions concerning her career, daily living within her family, and care for other family members. Looking back at scenes of clinical practice, many physicians may have noticed that unintentional comments or positive consideration increased wellness of female patients. The supportive attitudes of physicians to understand the variety of lifestyles of women, realize difficulties they face, and offer support are indispensable in the diagnosis and treatment of female patients who visit medical facilities. Next, an outline of mental and physical features and social status in each life stage of women are discussed, as well as the involvement of physicians. Health issues in various life stages. Puberty, adolescence. Puberty, adolescence, roughly corresponds to ages of students from junior high school through college. The first half of this period may specifically be called puberty, and the second half adolescence. One sense of values is developed during this period. The psychologist Erik Erikson stated in his life cycle theory that a human being establishes his or her identity during this period through repeated conflicts between pursuit of ideals and various disappointments. The changes in recent society, including rapid development of the Internet society, the spread of mobile phones, excessive information, increased stress, and changes in the role of family all have exerted various unforeseen influences on young individuals in this period and on how they build relationships with others. The age of first menstruation, which had been on the decline, is fluctuating around 12 to 13 years of age. On the other hand, the increasing trend of early first intercourse has caused a marked rise in sexually transmitted diseases. Cases of pregnancy and induced abortion in teens and flashes, abnormal sweating, and vertigo. Psychiatric symptoms like mood changes may also occur, as well as urinary incontinence and migraine. Though the severity varies, some develop morbid conditions called menopausal, climacteric disorders depending on personality factors and social environmental features, which may require medical treatment. With estrogen deficiency, osteoporosis due to increased bone resorption, hypercholesterolemia due to decreased LDL receptors, and atherosclerosis may progress. These diseases are also associated with lifestyle habits and call for active intervention. The health issues that should be addressed for women in the climacteric period change to screening for breast cancer and uterine cancer, along with prevention and early detection of latent diseases. In order to help patients prepare for their next life stage, for women of this age, it might be helpful to advise them to enjoy hobbies and help them find opportunities to contribute to the community. It is also important for patients to maintain their appropriate level of exercise, establish a network in the community, and secure the access to necessary medical care. Post-climacteric, elderly, years. In this period, ovarian function is almost at its end, and issues associated with aging begin to grow. People in this age experience the loss of others they are close to and become aware of a decline in their own physical strength and memory. Financial issues as well as social factors such as need of care or solitary living pose considerable problems, too. Feeling anxious about their physical symptoms and diseases and concerned about what is to come in old age, acceptance of one's own aging and death, and conquering one's mental issues are important subjects in this period. People look back over their own life and accept the past or try to fill the gaps. Elderly patients often have more than one medical condition and regularly visit medical facilities. The risk of cardiac and cerebral vascular diseases for women and men are about the same, and the chance of developing malignant neoplasm increases. In outpatient care, attention should also be paid to their nutritional status, presence/absence of sensory organ disorders such as reduced visual or hearing acuity, dysphagia, and risk of falls, in addition to the signs and symptoms of illness that brought them to seek medical consultation. Prevention of falls is critical. Conditions such as urinary incontinence, increased frequency of urination, uterine prolapse, and pain or discomfort from atrophic vaginitis can greatly affect the quality of life. But such problems are difficult for patients to voice, so physicians must actively ask them. Screening for dementia and depression on a regular basis is also important. Healthcare providers should show respect for the patient's life and have ears to listen to his or her memories. It is also desirable to talk with patients while they can make decisions by themselves as to what extent they wish to receive invasive treatment if they develop a serious condition. In recent years in Japan, we are seeing more situations in which an elderly person is taking care of her/his spouse, elderly to elderly care, or a patient with dementia is taking care of a demented family member. To deal with the anxiety and difficulty associated with solitary old people, various social support including community cooperation and active use of welfare services is necessary, and physicians are advised to become fully familiar with the knowledge of available social resources. At the same time, support to maintain the well-being of the family members who bear the burden of continuous care of the elderly is another important factor to consider for the senior patient's wellness. Violence toward women and the well-being of women. Abuse and domestic violence, DV. Violence toward women can occur at any life stage. It is reported that victims of violence, including sexual assault and child abuse, often suffer from serious long-term manifestation of depressive symptoms and diverse physical symptoms. If an adult patient who has chronic pain or indefinable physical symptoms complains of such symptoms and does not respond to treatment, or patients who have severe symptoms that exceed expectations, the possibility of some form of abuse in the past must be considered. Point 13. Physicians should take the presence of symptoms seriously, send the message that they understand its seriousness to the patient, and inquire about the facts openly with an unbiased attitude. Even if the abuse was a past event, the physician's attention may help the patient restore her own strength and well-being. Domestic violence and sexual abuse are not unusual troubles unique to certain people. In addition, the issue of elder abuse has surfaced in recent years. These problems are closely related to the well-being of women. Healthcare facilities are asked to play a significant role in the detection and treatment of victims and in providing relevant information to the authority. Being aware of different life stages and paying attention to the situations and circumstances of women can enable physicians to recognize problems that would have been easily left unnoticed. A helpful remark and kind affirmation from a physician may lead to improved wellness of female patients. Best regards. Thuniel Podcast. April 25, 2023.